Welcome, I'm Dr. Edmund Sulkowski, and this is Health and Wellness with Dr. Ed. We have a wonderful show today. You know, every day we get up and we take our five senses for granted. We see, we hear, we talk, you know. We don't think of anything until something goes wrong. And I asked Dr. Katie McNeilly to come on the show today to talk to us about hearing and how we can protect it, what we can do when we lose it. Welcome, Katie. It's a pleasure to have you on the show.
Thank you so much. It's nice to be here.
Tell us a little bit about your background, Katie.
So I am an audiologist by trade, which means I have a doctorate in audiology. I got that from the University of North Carolina. Previously, I had my bachelor's degree from the University of Pittsburgh. So after graduating with my doctorate, I came back up here to practice.
Yeah, we always come back home at some point in time, huh?
Yep, yeah.
And you're now with Crossroads Speech and Hearing?
Yeah.
And that's a wonderful organization that works with hearing loss. And I've actually had my hearing tested there at Crossroads a couple of times. And was always pleased to hear that I could still hear.
Yeah, it's a good feeling.
Yeah. So what is this mechanism that we take for granted, hearing? How does that work?
Yeah, I mean, it's a pretty complex mechanism. It's a three-part system: an outer ear, the ear canal to the eardrum, a middle ear space with the smallest bones in your body, and then an inner ear, which is a fluid-filled system that transmits sounds from, you know, mechanical energy to energy that it then gets transmitted through a nerve up to the brain.
Up to the brain, where the brain interprets whatever it's hearing.
Yeah.
So is this a vibration that it's picking up?
Yeah. So vibrations flow through the outer ear, becomes a mechanical movement through bones, and then an electrical signal is picked up from that vibration and sent to the brain.
So it's kind of like a human internet.
It is quite wild if you think about it, that we all have these systems that are working, and so many different parts have to work together for it to function appropriately.
So what do these things do?
The outer ear, the pinna, is just kind of working almost like a cone to collect sound and transmit that.
So when you're facing someone and you're hearing the sound coming directly at you, you pick that up cleaner. Mm-hmm. But if somebody's behind you because you're not having that opening behind you, or you're not getting that as effectively?
Yeah, that's exactly right. I mean, your ears are positioned to pick up more sound in front of you than behind. I mean, the other thing to note too is that having two ears kind of works together. You use different cues to kind of pick up where sounds are in space. Having two ears will kind of help you be able to tell, oh, someone's speaking behind me, and they're probably to my right or to my left.
And is that because it's that sound, that whatever is projecting, you know, making this sound, whether it's a voice or a musical instrument, is being bounced forward and then bouncing back to you?
Yeah.
Is that how that works?
Yeah, your ears are taking advantage of this thing called the head shadow effect. So your head is basically an object in space that sound has to get around. So your ears are it's kind of reflecting maybe off your head or to the sides, and your ears are picking it up from there.
So you're born, you're an infant, you've just been recently delivered. Can you hear?
Most children can, yes. So your hearing is developed pretty early in fetal development. So I can't remember the exact figure, but I mean, by the end of the first trimester, ears are developed and functioning. So in utero, babies are hearing. And then when you're born, the hearing system is presumably working and functioning appropriately, and all children have a newborn hearing screening. So.
And what's that involved? How do they determine that there might be a hearing problem?
Yeah, it's a test called an auditory brainstem response. So it involves putting electrodes on the baby's forehead and behind their ears, and it's measuring the response to sound via the neural network and the pathway by just recording electric stimuli.
And that's important. Why?
And it's important to know if there's any sort of pre-birth hearing loss that could have happened, any trauma that could have caused hearing loss, just because, I mean, hearing is so important to communication and development of speech and language. And
that's kind of critical, because if you're not able to hear, because we kind of mimic, right? When we learn our speech by mimicking.
Yeah.
And if you're not able to hear properly, you're not able to then form the sounds.
Yeah, that's exactly right. If you have significant hearing loss at birth, oftentimes learning speech and developing speech is more difficult. Obviously, children that may have hearing loss from birth use other things like sign language to develop language. So language isn't necessarily the problem, it's the speech sounds that become an issue if there's hearing loss from birth.
So we have this alphabet, and especially when like you're on the phone, for example,
Yeah.
and you say the word P, for example, or S, and then you have to say S like Sam, P like
Yeah.
Paul. Why does that happen?
The phone is a terrible thing to listen through. I know I don't have much hearing loss at all, but I really struggle on the phone. Phone calls are a pretty degraded signal when compared to a normal conversation face to face. It's speech that's then transmitted and then kind of flipped back around to speech for the other person to hear you. So a lot of speech sounds kind of get muddled in that process.
So again, it's that frequency, that vibration that's being changed.
Exactly.
And then,
yeah.
So we have these ears, which I think are anatomically ugly myself, but
To each their own. Yeah.
But there's like a megaphone that picks this frequency up, this air formation.
Yeah.
And it enters the canal, and then what happens?
So then it gets transmitted into vibrations, kind of like you said. So the eardrum kind of picks up those sound signals and then turns it into different vibrations based on frequency. That gets transmitted to the middle ear space where those little bones are that kind of move and help actually amplify the sound up. So 3 bones working together to transmit that sound to that fluid-filled sac I mentioned called the cochlea. And then that's pushing fluid at a certain rate based off of the frequency or the pitch that the sound is being transmitted as. That moves small hair cells that are kind of lodged within that fluid that picks those up and then changes them into an electrical signal that gets picked up by the nerve and transmits all the way to the brain.
Really pretty amazing.
It is really amazing.
When you sit down and think about it.
Yeah, it's during like my anatomy classes in school, we were looking at the structures, and all 3 of those bones that I mentioned can fit pretty easily on a penny. They are the smallest bones in the human body, and I get excited every time I see them. It's something I'm always excited about, even years after I finish training.
Well, I got to tell you, when I was in school, and we were dissecting cadavers, and we had different sessions, and we had to reassemble a skull bone by bone.
Yeah.
And those were the most, because they look like splinters.
Yeah, they're so small.
Yeah. And you sit there and think, I don't even know where these go.
Right. Yeah.
And you're going by a model that has everything assembled, and it's amazing.
They're the pieces that you're left over with, and you're like, how do these even? And they're suspended by muscles, so they really don't kind of fit in with a lot of the other bones in the head and neck area.
So, you see people that have hearing. I've seen people with cochlear implants, and we can talk maybe a little later about that. But what are some of the first signs of hearing loss?
The big things that people tend to notice is that they're just struggling with conversation. They're asking for more repetition. And the other thing that people don't always like to admit, but their family members and their friends are noticing that they're not picking up as much. A lot of times, relatives and people close to you are the ones that may notice before you actually do, which is hard.
And it's hard to tell somebody that they have a hearing loss because they get offended pretty quickly.
Oh, yeah.
Because it's kind of a denial type situation.
Yeah, and you never want to be the one to be the last to know. You never want to be the one that people are like getting frustrated with and kind of feeling like you're the odd one out. So that is hard. Yeah.
Are there certain words that you start to not hear early on? So
for most older adults, when they have hearing loss, they pretty typically have a high frequency hearing loss. Those are the areas that we tend to lose quicker with age and then with noise exposure, that type of thing. So it's not necessarily words, but different speech sounds. So the high pitch consonant sounds in English are the ones that people tend to have the most difficulty with. That's like the SH sound, the sh, the th sound. Those are the things that typically kind of we lose first, and that kind of makes speech a little bit less clear. Those sounds in English are what makes up the clarity of speech. So not necessarily words, but just things become more dull, more difficult to understand even when they're loud.
So if someone is constantly asking, what did you say, or what are some of the other words or signals that people give that they're having trouble hearing?
I mean, they might not be saying anything at all. They may be just kind of retracting into themselves, not seeming like they're participating, kind of just sort of sitting there, just seeming a little bit detached from conversation. I mean, you hear people saying, what? Or just kind of not really engaging as much. Those are, I mean, big signs that it may be time to get your hearing tested, may be time to kind of look into options if you feel like you're just not participating as much or just can't participate as well in conversation.
So if you're finding that you have to turn the television up louder, that's a signal?
That can be. I will say I struggle watching television and I have a pretty normal hearing system. The TV's not, again, very much like the phone, is not the best signal. Typically, especially with new TVs, the speakers are actually on the back.
Yeah, exactly.
Yeah.
And personally, I have a sound bar.
Yeah.
You know, I don't watch a lot of TV, but
Yeah.
I like movies sometimes, and the sound bar has actually that center speaker right up front for voice.
Exactly.
And it makes a tremendous
Yeah.
difference when somebody's talking on the TV.
Right. I recommend that to a lot of people because, yeah, with the normal TV speakers on the back, so it's reflecting off a wall and then coming to you after that. So not a great signal.
It's not only reflecting off the wall, but it's bouncing back on the TV, which
Exactly.
is bouncing it back to the
Yeah,
wall.
so just a lot of
yeah.
degradation by the time it gets to you. And the other thing too is with TV, a lot of times music, background sounds are kind of just as loud as the dialogue. Commercials are really loud for whatever reason. So there's a lot of adjusting people are having to do. So
is there a certain age in particular that you've noticed in your career that somebody starts to say, hey, yes, I can't hear as well?
I mean, it really depends on the population. So with the typical population, usually 65 is really where people are starting to say, I don't feel like I'm hearing as well. I used to spend a lot of time working with veterans, so for a lot of those people, it's much earlier.
Probably because of firearms and the type of environment that they're in.
Noise exposure has a huge
yeah.
impact on hearing loss. So,
Difference between hearing loss and the timeline between men and women?
not typically. I mean, I do tend to see some men coming in earlier. I do think that could just be related to them having more experience with firearms, maybe working with power tools.
Construction.
I mean, I mean, with just how roles in the workplace are, I think more men tend to be doing jobs like construction in the military, especially, in the past 20, 30, 40 years.
So what are the professions and jobs that cause the most ear damage?
I mean, the military is probably number one. I see a lot of retired mine and steel workers in my office who have hearing loss, construction, dentists.
Oh, I know, that's a bad one.
Yeah. Drills are really loud. Yeah,
and not only are they loud, they're that high-pitched.
exactly.
Yeah, and then on top of that, you're 3 inches away from them.
Yeah, and you're just, your occupation means you're exposed to them quite often.
Yeah.
So, yeah, that's one that people don't always realize. Yeah.
It's kind of interesting because we have in our office 5 operatories. They all have numerous high speeds and low speeds, and they all sound different.
Yeah.
Because they're mechanically different and so
Right.
forth, and older and newer or whatever. Mm-hmm. And even when you change the burrs, it changes the sound. I'm kind of a little sensitive to sound.
Yeah.
So I noticed that, but I also noticed that I tune those things out.
Yeah.
I'll tune the stereo system out because I don't like the music that the office plays,
Yeah.
and then I'll tune the drill out, and I seriously don't hear it.
Yeah, that's
after I start using it.
Very common. I mean, we kind of get used to the sounds in our environment within 10, 15 minutes, and if it's something, an everyday sound your body's used to, your body knows that's not something that's important for me to pay attention to. Yeah.
So, as children, we're pretty abusive to ourselves, and I think even as adults, we're pretty abusive. If we get smacked in the ear, can that cause a problem?
Yeah, it could, depending on how hard you were hit. I used to work at the Eye and Ear Institute in Oakland, in the city, and I saw a lot of trauma patients. So people coming in that may have had some sort of hit to the side in like a car accident, that can cause a perforation or a hole in the eardrum. Enough pressure can just kind of make that eardrum kind of pop open. An eardrum is actually, I mean, it's about the width of a piece of tissue paper, so really, really thin, delicate structure.
And the eardrum picks up the vibrations that you were talking about. And so if there's a perforation there, you can have partial hearing or total loss of hearing.
Yeah, depending on how large that perforation is, it can cause quite a bit of hearing loss. I mean, like you said, sounds cannot travel through the hearing mechanism appropriately if that is not completely intact. So if that happens, typically people go into surgery to get that repaired if it's a big enough hole.
So there is a surgery that they can, by sutures that would repair that?
Yeah, so it's called a tympanoplasty. So they take a piece of skin from another area and kind of patch it, and then that helps it heal a little bit quicker. If it's a small hole, usually it can heal on its own, but if it's big enough, they'll patch it.
Kids always get ear infections, and I was a swimmer, and my trick was always putting a little bit of isopropyl alcohol in my eardrum, in my ears, and get that out of there, because alcohol displaces the moisture.
Right. Yeah.
And there's something that everybody refers to as swimmer's ear, but that's nothing more than an infection of stagnant water.
Exactly. Yeah.
So, but kids typically get ear infections. Can that create a lot of damage?
I mean, yeah, I think so. It kind of depends on how you look at it. So there are two types of ear infections. There's a swimmer's ear, which is an infection of the outer ear space in front of the eardrum. So just from your outer ear to the eardrum. That is exactly like you said, caused by stagnant water, just bacteria from swimming.
And your own bacteria.
Yeah, and your own bacteria can just kind of cause an infection. And then there's a middle ear infection. So that's what we typically think of when kids have colds, and then little kids sometimes can get a fever, and then they're just not hearing as well. That's fluid buildup in that middle ear space where those bones are, increase in pressure in the ear, and it just, again, causes a temporary, usually, hearing loss where just sound can't travel through the hearing mechanism appropriately.
That creates a lot of pain because of the pressure.
Yeah, pain and just irritability in little kids, and I mean, it's causing a temporary hearing loss. So if a kid gets recurrent infection after infection, that's going to create a hearing loss that's lasting for quite a while. And even after the active infection is gone, a lot of times that fluid stays in place for quite a while, leaving the hearing loss.
Yeah, well, I think what most people don't realize is the ear canal, the esophagus, the sinuses, the nostril, the nose, mouth are all connected.
Yeah.
And you can get an infection in one spot, goes to another spot, and creates another problem.
Yeah.
And it's constant wash of bacteria. So if you're, for example, not having the best oral care at home, you can develop an ear infection as a result of the bacteria that's in your mouth.
Right.
Or a sinus infection, or vice versa.
Exactly. Yeah.
And so I think it's important for people to understand that you really, you're all your parts are connected.
Yeah. Yeah.
And if you're neglecting one part, the other part can have a problem.
Yeah. Yeah.
And when I was a kid, I always had tonsillitis. Until they removed them.
Yeah.
And I always had ear infections.
Right. Yeah. I mean, it's all connected.
Yeah.
The eustachian tube is there going from the ear to the back of the throat just to help equalize pressure, which is a good thing. We don't want a buildup of pressure in our ears, but that also means, like you said, bacteria can travel up and kind of get stuck and lodged in this middle ear space, and it's no good.
I remember my mother taking an iron skillet, taking table salt, heating the salt, putting it in a tube sock, and me holding the sock on my ear, and it would relieve the pressure.
Really? Oh, that's interesting.
It's just probably something she learned from her mom.
Yeah, just something passed down.
Yeah.
Generation to generation. Very interesting.
So it was I don't know what they do today, for that, but
number of different things. Yeah, typically treating with antibiotics if it's an active infection, and then if kids have recurrent ear infections, placing tubes in their ears, which is actually just a minor surgery where they put a little cut in the eardrum and place a little plastic tube. Just it helps equalize pressure and helps kind of get rid of some of that fluid that might be in the ear.
So that equalizing in pressure is something that we notice when we're flying?
Yeah. Yep. So as we go up, we're increasing altitude. Your eustachian tubes are supposed to kind of open up and allow pressure not to build in your middle ear space. But sometimes if that just doesn't happen.
And that's where that pressure is coming from?
Yeah. So there is no equalization between the outside world and your ear.
So if you fly a lot, and you have a cold and you have an ear problem, that
Yeah.
can really be extremely painful.
Yeah, oh yeah. I mean, I know, I remember one time I flew and I had a little bit of, I was getting over a cold and I had extreme pain in my ears just because,
It's a little fluid imbalance.
yeah, it was pretty painful. So, I mean, typically when flying, I recommend chewing gum, that type of
So that's
thing.
not a wise tell, that's something you
No,
should be doing.
yeah, I mean, it helps just kind of keep everything open a little bit. yeah.
Sugarless gum, by the way.
Yes, exactly, sugarless gum. Yeah.
And
yeah.
so that movement keeps the
Yeah.
equilibrium there,
Yeah.
relieving the pressure.
It's just keeping that eustachian tube open, or hoping to keep it a little bit more open to just keep airflow.
Does it matter to sleep on, whether you sleep on your side or on your back?
It shouldn't.
No?
No, yeah, I wouldn't say that. That shouldn't cause any issue in terms of pressure equalization. Yeah, yeah.
So, and some of us are probably guilty more than others, but there's this little thing with a little stick with a little cotton swab at the end of it.
Yeah.
Should we be using those things?
Probably not. No. I don't recommend putting anything in your ear. Typically, Q-tips. I know, and I've been guilty in the past of using Q-tips as well to clean out your ears because it feels pretty nice and you just feel like you're keeping your body clean. But typically, Q-tips are actually just pushing wax further into your ear canal, and they're very dry. They tend to dry out your ear. Your ear is pretty sensitive and needs a little bit of moisture.
Yeah.
And it's just kind of sucking up all that moisture, so your ear may be more itchy, which means you may be using more Q-tips, and just kind of creates a cycle of impacted wax and a dry ear.
So it's okay to take a Q-tip and go on these outer folds. What are
Yeah,
these outer folds
yeah.
called?
I mean, it's the pinna, and there's the helix, anti-helix, just the folds of the outer ear.
So they're actually, those things are designed to kind of channel the sound into your inner ear. I mean, speaker systems do that.
Yeah.
They just mimic the ear.
Yeah, so yeah, it's definitely fine to use a Q-tip on the outside of the ear, and even just right at the opening of the canal. That's totally fine. You just don't want to be shoving wax further in.
So you're going to naturally build up with wax because it's a body's protective measure.
It's antifungal, it's keeping things from growing in there.
So how do you clean that out?
So the ears, people don't really know this, but the ears are actually like self-cleaning. They have small hairs in the canal that sort of help to push wax out, almost like a conveyor belt. So wax is produced and it just kind of slowly works its way out on its own. For some people, they have an overproduction of wax, and it can get impacted even if you're not putting anything in your ears. So my best recommendation is using a wax softening agent. You can get it at the pharmacy called D-Brox. It's just gonna kind of help loosen that up and kind of help it work its way out. And then if there really is a huge issue with impaction, going to your PCP, going to an ear, nose, and throat doctor to clean your ears out occasionally.
They usually have a solution and they go in there with an instrument and
Yeah,
they
either
soften it and then kind of get it out.
Yeah, usually manually with the tool, or the flushing method where they're kind of squirting water in your ear to kind of help work that out, which isn't the most fun, but yeah.
So if I notice that my hearing is diminishing, should I suspect a wax buildup first before I do anything?
I mean, I think that's the first thing you can check. If you were going to come into my office and say, I'm really having trouble hearing, the first thing I'm going to do is look in your ears. Because if there's a significant amount of wax, and if it's in a completely occluding amount, that can cause, a moderate hearing loss. So,
Because that's a layer,
yeah,
like you do
plug.
when you're canning and you put a layer of wax on the top of the jar that's what's happening inside your ear.
Yeah, it's basically an earplug.
Earplug, so the sound can't even get into the drum.
Yeah, so that's, if I saw a significant amount of wax in your ear, I would just send you to your doctor to get that cleaned out before we proceeded with testing.
So the damage is done when you take that swab and you stick it down in your ear.
Yeah.
And you can actually perforate that eardrum.
You can. So if I've had quite a few people who were using a Q-tip, were startled in some way and kind of just popped it right into the eardrum, which is, it's pretty significant pain. And then it may involve a surgery to repair that. So yeah, just want to be careful.
So you're hearing in stereo. Because we have two ears.
Yeah.
So if you can get along through life okay with one ear.
You can, yeah, you can. You're still going to be able to hear with one ear, but there are a couple things that might be more difficult. So we kind of talked about this a little bit earlier, but being able to localize or tell where sounds are coming from in space is going to be really hard. We use these things called interaural time and level differences. So the way sounds kind of change between ears in terms of like the timing in which we hear things and the volume in which we hear things that help us determine where things are coming from in space.
You know, it's so bizarre because sometimes in your car and you'll have an ambulance or a fire truck and you'll hear that sound coming and you can't tell where it's coming from.
Yeah.
And even as it's getting louder, you still can't tell where it's coming from.
It's hard. It's really hard to tell.
You have both ears working.
Yeah, yeah.
You know, and then on the annoying side, you have somebody in the car that has one of those boom bass things that vibrates your car as well as their car.
Right, yeah.
And does that cause a lot of damage?
Oh yeah, yeah. My mom always says whenever she hears people with those types of speakers that those are the people that are going to keep me in business. Yeah, those can cause quite a bit of hearing loss. It's just, I mean, it's noise exposure. Just like anyone working in a noisy environment, if you're exposed to high levels of sound for long periods of time, that's going to cause, at first, temporary damage to your inner ear structure because it's acoustic trauma. Too much sound is causing.
That's a deep bass.
Yeah, yeah. Kind of too large of vibrations flowing through that inner ear, that fluid-filled structure, and then eventually can cause permanent damage over the long term.
Because I've actually felt like even like my heart vibrating sometimes when somebody's next to me with that. So it's kind of, we do all these things, and we're going to be going to a little break here in a minute. When we come back, I want to talk about some of the things like maybe even I'm guilty of wearing headsets and so forth and finding music way too loud.
Yeah,
but, you know.
and I get it. I mean, I also am a huge music fan, and you really want to be able to immerse yourself. So I understand why people do it, but yeah, it can cause significant consequences immediately and then even 30, 40 years down the road.
So in the olden days, you see the old movies where when somebody was hard hearing, they'd go, A.
Yeah.
Do people still do that?
Oh, yeah. Oh, yeah. Those are, I mean, small tricks you can use if you don't feel like you want a hearing aid, don't need some sort of device. I mean, there are different communication strategies, cupping your ear being one of them, to kind of help hear a little bit better.
So I've noticed with your hairstyle, your hair is covering your front of your ears.
Yeah.
Does that reduce hearing at all for people?
Not significantly. I mean, hair is kind of it's thin and it's pretty easy to move, so not going to cause much.
Even those vibrations still making it through the strands of hair and so forth.
Yeah.
And when we wear like things like ear muffs in the wintertime, is that helpful for us?
I mean, it's definitely helpful to keep your ears warm. I don't think it would cause a significant amount of reduction in sound. It will make things a little bit more muffled, but not enough to kind of negate wearing something to keep your ears warm.
So what is my first sign that because we're about to go to the break and I want to leave this for people to think about for a second.
Yeah.
What is the first sign that I should pay attention to that I'm losing my hearing?
I mean, that things are just not as clear anymore, that you're asking for repetition and that you're just not participating as much as you used to in the things you like to do.
And that's a little bit different than somebody just not paying attention.
Oh, yeah. I mean, and it's sometimes hard to determine whether you're not paying attention or you can't hear. So just kind of thinking about, is it that I don't want to be doing this or that I really just can't participate anymore? Because
I used to know someone who never heard what you were saying to her except when you whispered to somebody else, and she heard every word you said.
Yeah, and that's more selective than
more selective hearing loss.
Exactly.
You know, I'm going to ignore you because I don't want to hear what you have to say until you're saying something I think I should know.
Yeah, that's a little bit different.
Yeah, that's pretty cool. So we're going to take a break. We'll be back at Health and Wellness with Dr. Ed, with Dr. Katie McNeilly. Back to Health and Wellness with Dr. Ed. I'm Dr. Edmund Sulkowski, and we're here with Dr. Katie McNeilly talking about hearing loss. But, you know, we were talking about a variety of things that were actually amazing when you think how everything works and what we do to harm ourselves. So what I want to do in the next part of the show, Katie, is talk about how to prevent hearing loss. A little bit about what we're doing, and maybe I'm guilty with that as well, with those earbuds and loud music and so forth. And then some of the testing ways. I mean, yeah, I've experienced going and having a hearing loss test, going in that little box and hearing those things. I'd like you to explain that process so that people aren't afraid to do it, first of all, and then what to expect when they have it done.
Definitely.
So let's talk about loud music, because I like my music loud.
Yeah.
What am I setting myself up for?
So, I mean, over time, loud music is just an over-amplification of sound. And if you're doing that often, if you're listening to things quite loudly for extended amounts of time, that can just cause damage to your inner ear. That structure is pretty sensitive to sound, and when things are too loud, it can just cause a physical injury to those small hair cells in your cochlea, that inner ear fluid-filled structure.
So they're not vibrating at the frequency that they should be vibrating.
So yeah, typically inner and outer hair cells, we have both kinds, kind of sit straight up. And then with noise exposure, repeatedly, they kind of get bent, they break off, and that can just cause a signal not to be transmitted appropriately.
And they don't regenerate?
Unfortunately, they don't. So if you've had a significant noise exposure one time and you notice maybe your ears are ringing, you feel fullness, you feel like you're not hearing as well, that is a temporary noise trauma typically. So they can kind of sort of pop back up. But over time, if that's continuing, they can end up getting damaged permanently and they don't come back.
And so I know I'm guilty. I love my music loud.
Yeah,
you know,
me too.
And fortunately, I still hear all those notes.
Yeah.
You know, but I guess if I stop hearing them, I'll just crank it up louder. I don't know.
Yeah.
But I've been guilty my whole life with earbuds. I've worn. You know, I think I went through school tuning the world out, just listening to music and I had my earbuds in. Is there a potential damage, a lot of damage from that?
Yeah, I mean, absolutely. Just like any sort of speaker system. Typically, my rule of thumb is not listening to sound over 50% of the way on your volume control, like on your phone, that type of thing. I know now phones typically have a high, like, a warning saying things are getting too loud.
I've heard that a few times on my phone.
Yeah,
yes.
and I know most people, honestly, most people tell me they just turn it off, which I understand. I also turn it off because I know kind of how loud to make things. But the rule of thumb is listening to sounds over 50% on your phone or on your stereo system could cause lasting damage to your hearing.
So everybody's earbudding now with Bluetooth. So that's what we're talking about, not to do that.
Yeah.
Not wear the Bluetooth thing, but just don't turn it up full volume.
Yeah, I mean, listening to, and I listen to music all the time with different types of headphones, headsets, Bluetooth, wireless things. Just making sure, being cognizant that you're not listening to things too loudly. Yeah.
Yeah, I have to pay more attention to that.
It's hard though. Like I said, I mean, you want to be immersed in the music and whatever you're listening to and tune out maybe other things that you don't want to be hearing. So I understand the temptation to turn things up louder.
Are there systemic diseases that can impact the ear?
Oh yeah. There's a lot of different diseases that may have an impact. I mean, there are specific ear diseases. Commonly, people maybe have heard of Meniere's disease. And then there are other things that can happen that can also cause hearing loss.
So let's talk about Meniere's, because that's kind of an interesting syndrome there.
Yeah.
So it's a French man. That's Meniere, but it's in your ear.
Yes.
So it's kind of ironic.
Right.
But what does that disease do? And is it a permanent, or is it reversible, or is it intermittent type thing?
Unfortunately, it is permanent. So it's overproduction of fluid in your inner ear, in the cochlea. So the cochlea is as we've talked about, a very delicate structure, and it has a certain amount of fluid in it to kind of keep itself functioning. With an overproduction, it it gets too full and pressure increases, and it can cause issues with drop attacks and balance, where you have vertigo for up to, can be up to 12, 14 hours straight of just a sensation where a room is spinning around you.
And you're non-functional when you have severe vertigo.
Yeah, and it can come on without warning. You can just kind of have an attack of vertigo. And then typically along with that comes hearing loss as well as tinnitus or ringing in the ears.
So that's a whole another topic we need to talk about, because I think it's so prevalent.
Oh yeah, it is. It is.
So when you have that buildup of fluid,
Yeah.
and you're getting this vertigo, can certain foods cause that?
So there has been some research to say that high salt diets can have more of an impact on that. Meniere's disease is probably going to be prevalent. You may have it even if you don't have a very high salt diet, but to control some of those intense vertigo attacks, a lot of times doctors recommend cutting out salt or reducing your salt intake pretty significantly.
That's interesting, because you are really a saline solution.
Yeah,
so
right.
You are salt and water.
Yeah, yeah.
Does chocolate impact that?
Not that I know of. I'm not sure. I haven't heard of that causing any sort of impact on Meniere's disease or dizziness at all.
What about allergies?
Oh yeah, allergies definitely. So as you mentioned, the whole ear, nose, throat system is all connected through a series of, tubes, just kind of keeping things equalized. But allergies can, give you kind of runny nose, kind of drainage from the sinus passages, and that can get into the middle ear space, causing plugged ears, pain in your ears.
So you get that vertigo, you get that nausea feeling, you can't lift your head, the room's spinning.
Yeah.
And can that happen from wax buildup, excessive wax buildup?
If it was really excessive, it may cause that. Typically, wax buildup isn't going to be the cause. Sometimes allergies can cause that, just because it's changing the pressure, and which can change the pressure in the inner ear, which can impact your balance. But typically, wax isn't going to be significant enough to cause that, thankfully.
So you mentioned a big one, and tinnitus or tinnitus, depending on who's saying it.
Both are right. Yeah.
What exactly is that?
So it's any sort of sounds that you may hear in your ears that is lacking a cause from the external world.
So it's not ambient sound, it's not music, it's not the TV on, or your phone talking to you, or buzzing, or Alexa or anything.
Yeah, yeah.
It's a buzzing or a ringing sound?
Buzzing, ringing. I've heard someone say it sounds like chimes, it sounds like music. Just a dinging or a chirping. All of those things could be classified as tinnitus. Yeah.
And what causes that?
It can be caused by a number of things. So different things, if you have severe wax impaction, that can cause tinnitus. If you have an issue in your middle ear with those bones in that space, that could cause tinnitus. And then noise exposure can cause ringing in the ear. It's just, there's different parts of the ear that could be impacted that can cause it. And there's not a lot known about what really causes it, but typically, most commonly, it's caused by noise exposure and just kind of an aging system.
So as your blood vessels thicken, and then the flow of blood and oxygen and so forth reduces, then you end up picking up less vibration, or
lack of blood to the ear can cause hearing loss and can just make things not travel the way they should. A lot of times people think tinnitus is caused by a lack of sound getting to the nerve and the brain, and it's your body's way of trying to say, wait, I am still hearing something. It's your body's way of compensating.
You just gave me a flashback, because it's that brain-hearing connection that you were talking about. I had surgery one time and woke up from the anesthetic, and I heard Chaka Khan, that song, Chaka Khan.
Yeah.
And I said, that music is so loud, please turn it off. And the nurses around me start laughing.
Yeah.
And they said, there's no music.
Oh no.
And I said, yeah, I hear Chaka Khan, Chaka Khan. So whatever that anesthesia did to my brain, I woke up, and I was hearing it to the point where it was like annoying.
Almost like an auditory hallucination.
Exactly. So there is that connection, and any tiny little thing can mess that up.
Oh yeah, and tinnitus, if it's loud enough, can be quite debilitating for some people. It's a lot of times it's linked kind of with anxiety. So an increase in tinnitus often makes people's blood pressure go up, makes people feel more anxious.
And that can have an impact too, just
Yeah.
the change in the blood pressure.
Yeah, it can be really, I mean, a lot of times if I have someone who has very significant bothersome tinnitus, we also want to check in just mental health wise. Are you having any concerns about like depression, anxiety? Are you considering hurting yourself, suicide? Because there have been cases where people have had tinnitus or ringing in the ears bad enough that they have completed suicide. So just a lot of interconnection between mental health and that. So you always want to check in with people and just kind of make sure everything is okay.
I can imagine it's like something you can't turn off.
Exactly, yeah. It's a constant sound, and if it's something that you're noticing and you just can't get rid of, it can really just kind of make you feel crazy. So it's just, yeah.
And what's the treatment?
Unfortunately, there is not a lot of treatment that has been verified and research can kind of back. So typically, if I have someone with bothersome tinnitus, I recommend sound therapy. So using an amplified sound, like using hearing aids to produce a little bit of extra sound, just generally and environmentally, and then also adding in a tinnitus sound masker. So a kind of steady state white noise background sound for someone to listen to that'll kind of help them, give them something else to hear, and kind of helps blend with the tinnitus to make it less bothersome.
So they're using some of that same technology in cars today, because I know I've had cars that produce some kind of sound that you don't really hear to make the car quieter. Yeah,
it kind of just helps distract you maybe from road noise, that type of thing. I mean, people don't realize how loud riding in the car can be, and sometimes that can be pretty bothersome to some people. So
I think the tires generate a ton of noise. And it just vibrates, the same principle as the eardrum and everything right up through the car.
Amplifies
through your bones.
Yep, exactly.
Because there's technology where you can have a hearing device for music, like an earbud or something that in fact, there was a company, I don't know if it's still in existence, they called it Jawbone. And it really didn't work on your eardrum so much, but it worked on your jawbone and the vibration, and then your eardrum picked it up.
Those are the headphones I wear. They sit on the outside of your ear, and they just send vibrations through your skull to your inner ear. It's called bone conduction. So by putting vibrations on your skull, that will just vibrate your head and then get into that fluid-filled cochlea space and kind of do the same thing.
And less chance of damage.
Not necessarily, but it's just a different way of hearing. If you had some sort of issue with your ear canal or inner or middle ear space where those bones are, you could wear bone conduction headphones and hear a little bit easier. So yeah, it's just, I run a lot, so I like to have my ears open and being able to hear environmental sounds as well as my music. So that's why I wear them,
And when I first moved back from Arizona, so Arizona's pretty much a less restrictive state than the forward-thinking state of Pennsylvania, but I'm being sarcastic there. But in Arizona, you can wear earbuds in your ears and drive your car.
Oh yeah, yeah.
Well, evidently, there's a law in Pennsylvania where you can't do that, and I must not have known that. But when I first moved back, I was accustomed to driving with my earbuds in, and I'm driving the car, and I get pulled over by local police, not Peters Police, but another police department, and I knew I wasn't speeding. I knew, I wasn't violating anything, and I said, well, "What are you pulling me over for?" They said, "Well, you're wearing earbuds." I went, "So?"
Yeah.
And he said, "Well, you can only have one earbud."
Interesting. Okay, I didn't know that.
I can wear one earbud, but I can't wear two earbuds.
Yeah.
Why? Well, that's the law. And I said, well, if I was deaf and I couldn't hear a sound, is it legal for me to have a driver's license and drive? And the officer looked at me and said, yeah. I said, why isn't it legal for me to have earbuds in my ear? And they weren't on.
Yeah.
I just actually walked out of the house with earbuds on a phone call and never, took them out. And he said, well, it's the law.
Yeah.
So there was really no reason.
Right.
But, and I don't know where I'm going with this. It just, in the conversation, it was kind of weird. You can be legally driving being deaf and not be able to hear a siren or somebody's horn.
Yeah.
But I could still hear the siren and horn with the earbuds.
Right. I mean, I understand kind of their thought process saying that it is unsafe and could cause distracted driving. But I mean, it's not much different than, I mean, deaf people drive and are perfectly adequate drivers.
Exactly.
So
yeah, that was my
doesn't
argument.
really, yeah,
That was my argument.
yeah.
I mean, nothing came about this.
Yeah, of
It's,
course.
See you later.
Yeah.
But you know,
Yeah.
and I think I still had a Arizona driver's
Okay,
license at the
yeah.
time. But anyway, I'm off on a tangent.
No, I got you. I mean, I kind of agree with you. I mean, there's plenty of people that can't hear sirens and are very good at driving. So yeah, using visual cues is important. So yeah.
I just found that being born and raised in Pennsylvania and just used to how it works, and then having the experience of living away from it, coming back to see how backward it is,
right?
In a number of ways. But anyway, so we have Meniere's disease, we have tinnitus or tinnitus. What are some of the other diseases that impact the ears that most people deal with? I
mean, typically ear diseases aren't things that people have to deal with, thankfully. Other things that can cause issues, they're middle ear issues like cholesteatomas, which is kind of like a small tumor that can form in the middle ear space. If you've had recurrent ear infections, typically those need to be surgically removed.
And they're typically non-malignant tumors?
Non-malignant, yeah. And then there can be tumors that grow on the auditory nerve as well, that can cause an impact on hearing and can cause tinnitus as well, and issues with balance if it's big enough. Also, I mean, they're benign and just usually need to be removed if they're too big. But typically, hearing loss, tinnitus is not caused by an ear disease and is more just caused by aging, noise exposure, genetics.
I was just going to ask you, genetics involved in that? There's some hereditary aspect to it? Yeah,
huge. Yeah, I would say, I know hereditary hearing loss is big in my family. On my mom's side, a lot of my family members are profoundly deaf and were by the age of 60. So it's something that I just keep in mind when I'm thinking about protecting my hearing and my future, knowing that may be kind of where I end up. So, yeah.
I have a friend, I won't mention his name, Mike, who has a hearing issue.
Yeah.
Who won't admit to it.
Sure.
All right.
Yeah.
And I think it's because of, in the olden days, with maybe parents or grandparents, when they had hearing aids, and they had these big, clunky things that sat in the ear. And I think that creates a stigma.
Oh, yeah.
So what's the impact of stigma with hearing loss on people in their daily lives?
I mean, it's huge. I think a lot of times people think about, exactly like your friend, think about what the way hearing aids looked and kind of sounded, quite a while ago, and are still thinking that's how it is today. And I mean, the idea that hearing aids make you look old, make you feel old, is kind of still a big factor in why people may not want to be wearing them. The statistic is that usually it takes people about 7 years to seek treatment for hearing loss after they realize.
Really?
Yeah, so it is quite a while.
So you're missing out on conversation
and
whatever for 7 years before you finally say, I need to do something about it?
Yeah, it's quite...
because it doesn't hurt.
Yes,
it doesn't cause
exactly,
pain, so we can deal with it.
And I don't want to admit to myself that this is actually a problem. This is a problem that old people have. I'm not old, so that's a big kind of factor. And that's kind of, I see that quite a lot. A lot of times maybe people aren't ready, but their family members are kind of forcing them to come in because they're saying, you're not hearing well. So
it's one of the signs is one of the other family members is yelling, and you're saying, well, why are you yelling at me?
Yeah.
Right?
Yeah, I've seen quite a lot of marital strife based off of communication breakdowns due to hearing loss. So, yeah, not uncommon, unfortunately.
So, in the old movies, when they had the big, what were they called, xylophones, or what were they?
Yeah, like an ear horn.
Whatever they were sticking out. We don't do that anymore.
Oh, absolutely not. No, we don't have those. No.
So, how do we amplify sound loss when we're having this problem?
Typically using a hearing aid. So it's something that's worn on ear in the ear, and it's taking in sound, it's amplifying and then transmitting it into your ear. So it's programmed specifically for the person with hearing loss. So it's kind of amplifying only the sounds they need it to amplify, taking into account different acoustic cues and then sending it in.
So you're looking at the frequencies of loss. So you, so that's probably a good time to talk about getting tested.
Yeah, yeah.
So what's the protocols for being tested for hearing loss?
So if you were going to come in to get a hearing test with me, the first thing I would do, as we talked about earlier, is taking a look in your ears, making sure there's no wax occlusion. Then it's going into that sound booth. So a soundproof room where I would typically close the door and you'd be sitting in quiet. You're listening for beeping sounds.
Do you need a referral from a physician to walk into Crossroads Speech and Hearing, or you just call up and make an appointment?
You can usually call up and make an appointment. Depending on insurance, we sometimes need a script from primary care physicians, especially if you have Medicare. So we just may need to know who's your primary care physician, and then we'll call and get that for you. So you can usually just call. It's pretty easy.
So this is basically the little soundproof booth. And
Yes.
then you get a set of hearing aids. I only say that because I've been through it.
Headphones, yeah.
I mean, what I say?
Yeah, hearing aids. But
Hearing aids,
I know what you mean, yeah.
Headphones, yeah. And
Yeah.
there's a little window, and somebody like yourself was on the other side of that window.
Staring at you, yeah.
And you're doing something on a keyboard.
Yeah. So what I'm doing is, especially when we're looking for your sensitivity to sound, I'm looking for where you can respond to soft beeping sounds at multiple different frequencies or pitches. And I'm looking for you to respond about 50% of the time. So typically people can see me through the window kind of clicking around because I'm changing the pitch, changing the volume, and looking for you to respond. So, and I know it's nerve-wracking to be in there. I hate it myself. I've been in a sound booth countless times.
Claustrophobic.
Yes, and I do get a little bit claustrophobic, and I just do get a little bit anxious in there because I'm worried I'm not doing well or I'm over responding. So just know that if that's a fear of yours, I'm used to it. I'm used to cracking the door for people that may be claustrophobic, and you're never going to be.
But it's a painless painless encounter.
Yeah, it is.
And it doesn't
really
take
is.
very long.
No, it's about a 20-25 minute test.
Yeah, that's what I remember it being about.
Yeah, painless really is. And then, so we do those beeping sounds, and you're also repeating some words back to me that I may be saying, or I play a recorded list. Just because I want to see when sounds are loud or comfortably loud, how well do you do repeating words?
So then you get basically a chart.
Yes, yeah.
And it says you can hear here, you have a little loss here.
Yeah.
Everything else is fine.
Yes, yeah.
So if the loss, do you wait to a certain point of loss before you say, hey, we recommend now that you have a hearing aid?
Yeah, it really depends on the kind of shape of your hearing loss. If you have very, very good low pitch hearing and only just a little bit of high pitch hearing, that's kind of when I say you're probably not really needing a hearing aid yet. It's when we see kind of a general decline across frequencies is when we may say, okay, I think it's time.
Because I think with all these ridiculous masks everybody's wearing all the time, people are having a hard time hearing anyway because everybody's talking down and low and through a filter.
Yeah,
but anyway, you brought some interesting things here.
Yeah.
And I'd like you, because we're coming close to the end of the show. It goes by so fast.
I know.
Let's start with...
I brought all sorts of things.
Let's pick one up and
Sure.
just start talking about it.
Yeah, so I brought kind of hearing aids that I typically fit at my clinic. So typically now when we're fitting hearing aids, we're fitting things that are rechargeable. So sitting in a charger, the hearing aids are here.
And that's a big deal
Yeah.
because I've actually had to put in batteries for people.
It's hard.
And it's really difficult to get those batteries in those things.
It's definitely hard, and if someone is, in their 80s, 90s, and has dexterity issues, being able to put a hearing aid in a charger is a lot easier than changing batteries.
So this is outside the ear?
Yes, so this is called a behind the ear hearing aid. So this part sits behind your ear, this wire goes down in front, and then there's a little rubber dome on the end, and that's sitting in your ear. So
and it's tuned to the frequencies that you've lost.
Yeah.
So you, for example, with your hairstyle, you would never ever even know you had that.
You're correct. They're pretty discreet. This would be kind of blocked by my hair. That wire, it's very small. Honestly, my patients come in and I can't tell if they have their hearing aids in or not most of the time. And then this dome sits far enough in your ear, you really can't see it. So really discreet. And this style of hearing aids is honestly one of the most common because it's very versatile, can be rechargeable, can be connected to a cell phone. So
through Bluetooth?
Through Bluetooth, so you can stream phone calls, music, podcasts through the hearing aid. It's basically a Bluetooth headset that also amplifies sound. So really nice.
To your specific frequency.
Exactly. So
as opposed to, say, a iPod.
Yeah.
Which
is just kind of could generally amplify
Yeah.
something. Yeah. And then we do, so that's pretty common. We do also fit custom devices. So this is the smallest one I have, which sometimes people do want. It's called a completely in the canal hearing aid. So it's very tiny, and it's going to be sitting all the way in the ear canal.
So the part that's blue sits in the canal?
Blue sits in the canal.
Are we able to see that? I can't see the monitor, but
it's really hard to see. But the back, these typically still do take normal standard batteries. They're so small, we can't really make them rechargeable yet, and they're not always being able to be connected to the phone just because they're so tiny.
They're tiny.
Yeah.
But if you really want to be discreet about it, this is the way to go.
Exactly.
What is the little clear thing?
This clear thing, and again, it's probably really hard to see.
It's really hard to see,
but
even
it has
in your
a little ball at the end. That's a removal line. So it would just kind of stick out right at the entrance of your ear canal, so you can grab onto that and pull the hearing aid out. Because this is sitting far enough in there that it'd be real hard to get it out if you didn't have something to pull it out. Yeah.
That's really tiny. That's the tiniest one I've ever seen.
Right, and these hearing aids are custom made to you. So if you came in and said, I want the smallest hearing aid that sits in my ear, I would make an ear mold impression.
So much like we do in dentistry, you're going to put some alginate in your ear?
Yeah, it's a putty that hardens. So I would put a little cotton ball in your ear, fill your ear up with putty, wait about 5 minutes till it hardens, and then I would take that out and then send it in to a manufacturer who makes the hearing aid for you.
Awesome.
Yeah.
And then what else do we have?
What else do I have? So this is probably the biggest hearing aid someone would ever get fit with, and you really aren't going to be fit with something like this unless you have profound hearing loss. Very, very significant hearing loss. So if anyone's concerned, this is really the biggest you're going to get.
So the next thing would be a cochlear implant.
Yeah. So this type of hearing aid is also one that sits behind the ear, and then this is a custom-made ear mold, which would be made similarly to that other hearing aid, made with an impression for your ear, and it would just be sitting in there with a tube going down.
So there's a big difference in what you're seeing here than what you can get on TV for $59.95.
Yeah, I would definitely say that these are going to be program specific to you. They are quite a bit more expensive, I will say that, but they're made for you, programmed for you.
You get what you pay for.
And you get the care.
Yeah.
Typically,
follow up.
You'd be following up with me or seeing your audiologist frequently just to make sure things are functioning.
Hey, we were out of time, Doc. I'd like to thank Dr. Katie McNeilly from Crossroads Speech and Hearing. Contact information is up on the screen. Give a call. You'll benefit from it. You know, I was having arguments with my brother that he was telling me I couldn't hear, and I proved him wrong by going over to Crossroads and getting my hearing test. Anyway, thank you so much for watching Health and Wellness with Dr. Ed. Remember this, a healthy pet is a happy pet. When you're healthy, you're happy as well. And you can hear me live every Saturday morning at 9 o'clock to 10 o'clock a.m. on AM 1250 The Answer in Pittsburgh. We'll see you. Bye-bye. Thanks, everybody.